Good morning. Thank you for joining me today. We're certainly acknowledging the season that we're in and the reason for the season. Yesterday, I was grateful to be in Atlanta under the only other Gold Dome in Georgia to participate in an integral part of our federal elections process by casting an electoral college vote on behalf of the state of Georgia for President-elect Joe Biden and Vice President-elect Kamala Harris. I joined 15 distinguished Georgians under heavy security and carefully orchestrated COVID precautionary guidelines in carrying out a constitutionally ordained duty that has been conducted by Georgians since the founding of our country. The weight and the history of that moment are not lost on me, and I'm honored to have been selected as an elector. For those before me, those with us now, for our republic, for our form of government, for Savannah, for the coastal region of Georgia, our voices matter, and our voices were heard in the state capitol yesterday and across America. Early voting for Georgia's January 5th runoff election started yesterday and lasts through Thursday, December the 31st. So from now through the end of the year. You can vote early Monday through Friday at the following locations and times: the Savannah Civic Center from 9 a.m. to 4 p.m., Chatham County Mosquito Control from 9 a.m. to 4 p.m., the Islands Library from 10 a.m. to 4 p.m., and the Southwest Chatham Library from 10 a.m. to 4 p.m. Voting is available at the Board of Registrar's office on weekdays December the 14th through December the 22nd and December 28th through December 30th from 8 a.m. to 7 o'clock p.m. Saturday voting is available this Saturday, December 19th, and at the main office from 9 a.m. to 4 o'clock p.m. You can also vote at the main office on December the 23rd and December 31st from 8 a.m. to 5 o'clock p.m. There is no voting on December the 24th or 25th for the Christmas holiday. If you would like to request an absentee ballot, you can fill out the form online at ballotrequest.sos.ga.gov, ballotrequest.sos.ga.gov, or in person at the Board of Registrar's office located at 1117 Eisenhower Drive, Suite E. If you've already received your absentee ballot, as I have, and prefer to drop it off instead of mailing it, as I will, ballot drop boxes are now open across Chatham County. We have 10 locations: the Board of Elections office, the Savannah Civic Center, the Carver Heights Community Center, the Liberty City Community Center, the WW Law Community Center, the Southwest Chatham Library, the UGA Extension in Garden City, the Whitmarsh Island Chatham County Police Precinct, and the Pooler City Hall. We recognize that during this time, Savannah has, and will continue to receive a high level of attention from Senate and Public Service Commission candidates and their surrogates. And we just hope that we continue to receive this type of attention when the election is over. Our local public health and medical professionals are preparing to roll out COVID-19 vaccines to our most at-risk and vulnerable communities. The Coastal Health District received 2 shipments with 5,850 doses of the Pfizer vaccine yesterday. They vaccinated some of their frontline public health staff yesterday afternoon, and they're beginning a broader rollout to high-priority people in Chatham and Glenn and surrounding counties today. They are also making the vaccine available to local hospitals that are waiting on their own shipments. I am grateful to those that are coordinating this incredibly complicated and historic vaccine distribution, certainly our friend Dr. Davis and all the folks at the Coastal Health District, and we hope and pray and we'll do all we can to ensure everything goes smoothly. Big shout outs this morning to the UPS and FedEx employees who are transporting these vaccines around the world. I was also elated to see our very own Dawn Baker featured on the CNN Heroes presentation Sunday evening. Her efforts and those of many others that enrolled in the various clinical trials are helping us to get to the end of COVID-19, and I thank them for doing that. But even with a vaccine, we need to keep up the good health and hygiene practices we've been doing since March to slow the spread of COVID-19. It's very clear, and I know I sound like a broken record, wear a mask, stay at least 6 feet apart, avoid crowds, and wash your hands often. Watch your distance, wear a mask, wash your hands. COVID-19 cases and deaths are rising across the United States and unfortunately here as well. The Coastal Health District data shows that our COVID-19 cases here are trending up. Our Chatham County 7-day rolling average of new cases has increased from 48.7 a week ago to 75. From 48.7 a week ago to 75. The daily case rate per 100,000 is 25.7 compared to 16.7 last week. We're 25.7 a week ago, 16.7. And our positive test percentage rate is up to 9.8% from 7.5% a week ago. And when you look at states like New York where they are close to 3% and closing things down, I think that gives you some idea of how serious things are. Our community transmission rate index is now 301 compared to 228 a week ago and compared to 170 the week before that. So this is serious. Our clarion call remains clear. If we want to get out of this, the vaccine is not going to save us out of this. We have to continue the good habits that we've been doing. So we're just encouraging you, please, to do so, particularly as this holiday season is upon us, that if you're going to travel or if you're going to do whatever it is you're going to do, make sure you understand very clearly what the issues are. We have completed budget presentations for the 2021 budget. To this point, thanks to amazing work from our city managers, Pat Monahan and now Michael Brown, our budget and finance teams, and of course Team Savannah, our proposed budget is balanced, does not include any tax increases, fee increases, layoffs, or furloughs. And that came through very, very hard work and through some very creative belt tightening. This preserves critical social service and cultural arts funding and allows us to structurally reestablish the Savannah Impact Program by utilizing a violence interruption concept that has proved helpful in other cities in reducing violent and often gang-related crime. Per state law, the City Council will receive public comments on this Friday, December the 18th, and we plan to adopt the budget on December the 18th. This has been an extremely challenging budget year, and certainly, definitely not the year we were expecting. Thank God we have managed to maintain and remain afloat. In 2021, we fully expect to examine our budget monthly and make revisions as necessary. To try to ease the financial burdens our small businesses are facing, I am introducing a new part of our Resilient Savannah package that is called the Alcohol License Renewal Relief Program. Alcohol License Renewal Relief Program. We know that of all of the city licenses, that the alcohol license is the most expensive. Through this program, businesses will be able to pay for their 2021 Savannah alcohol license in 3 equal installments during the first quarter of 2021. Payments will be due on January the 31st, February 28th, and March the 31st, 2021. Businesses will sign an agreement and will receive a provisional license from the City of Savannah, which the city can revoke if payment terms are not met. Upon full payment of the required fees, the business will receive its regular 2021 license. This seemingly small but meaningful initiative is a win-win for our city and our businesses from facing remarkable challenges because of the pandemic. We're trying to find ways to help however we can. The Savannah Police Department continues to work through the Savannah Cares Task Force interim recommendations submitted in September. They have been discussed, debated, and researched extensively, and we are now at a point to announce some progress. Chief Roy Mentor has provided some updates on where we are in this process, and he's also here today if you have any specific questions for him. I'm proud to say that the Savannah Police Department has already made significant strides as an accredited law enforcement agency in altering current or adopting new policies and procedures to align with the committee's recommendations. And we'll release them later, but de-escalation training is already included in the Savannah Police Department's 2021 mandatory training curriculum for all members. All SPD personnel will complete a minimum of 16 hours of de-escalation training next year. 16 hours. Regarding crisis intervention training, SPD began certifying officers several years ago, and currently 70% of sworn personnel are certified. Additionally, 4 SPD supervisors and 26 officers, including both behavioral health unit officers, are certified enhanced crisis intervention team officers, which gives them an additional level of CIT training. All officers are now required to complete the 40-hour crisis intervention team training course before completing the training academy. The department is also working on scheduling 3 CIT classes per year to achieve our goal of 100% certification for all sworn members by 2024. And I think we're making substantial progress getting there. The Savannah Police Department completed a policy revision and standard operating procedure for its response to resistance committee, which reviews use of force incidents. SPD Major Devon Adams was appointed to chair this committee, and the department is working on establishing a new selection criterion for members of this committee. The police department has implemented several new programs to reduce the number of calls for service officers respond to allow them to spend more time in the community. In March, the Savannah Police Department activated the Remote Report Center. The Remote Report Center handles many reports that would have required a call for service for officers, and in June they implemented the Community Service Officers Program. The Community Service Officers Program, also known as CSOs, handle calls for service that only require completion of a police report. And to date, our CSOs have completed and handled over 200 calls for service, and the RRC has handled more than 3,000 calls for service. So again, this frees up officers to do police things. SPD also recently purchased 72 cell phones for patrol officers to use during their shifts to contact complainants before responding to a call to better understand the circumstances. And as someone who's done this before, I will tell you that it makes a whole lot of sense, particularly for situational awareness and officer safety, if the officer understands the situation from the complainant directly, because these situations change, they're very, very fluid, and again, I think it gives a better outcome. Each precinct has 18 phones assigned, and officers have been provided with information on the recommendation and encouraged to use this process. Also, SPD has removed the use of warning shots from its policy. The language has also been added to this policy stating that warning shots are prohibited under any circumstance. SPD is also working on a continuous public education campaign to help this community better understand its use of force policy and traffic stops before the COVID-19 pandemic. Officers plan to hold live use of force training demonstrations for our community, and they're now creating YouTube videos that better educate the public on the policy and the traffic contact procedure. SPD's SWAT commander has worked with team members to explain that SWAT uniforms, that the militarized uniforms, should only be worn during SWAT operations, not during something like felony warrant service operations, for example. Team members are no longer allowed to wear these uniforms unless they are involved in a tactical operation, which makes sense. You wear tactical uniforms when you're involved in tactical things. The department has also reversed its policy, or revised its policy to prohibit chokeholds. And the new policy says that bilateral neck restraints, the shoulder pin, which is a chokehold, are prohibited. Officers are prohibited from using any tactics or techniques that restrict the flow of air and or blood through the neck and head areas. Officers are prohibited from using chokeholds and techniques where knees are applied to the back of someone's neck while they're in the prone position. I am extremely thankful for the work and dedication to make meaningful change within our police department in less than just 3 months since receiving the CARES Act recommendations. And I certainly thank Attorney Diane McLeod and the members of the CARES Committee for the time that they've put through. This week we will announce the next phase of our engagement, in which they will be in the community learning about interaction of our citizens with the police department. I want to thank Chief Minter and the members of the police department for being receptive and for understanding that sometimes how we see ourselves is not always how other people see us. And I think that Chief Minter has accepted that challenge, and I want to thank the police department to do that. They are actively looking and working through other recommendations, and we will keep you posted on those outcomes. Today we will release the full slate of recommendations and Chief Minter's response to them. I will continue to tell you, and we will submit information, of course, that the amount of violence in our community remains at an unacceptable level. We certainly look for days where we don't have incidents that involve guns. I will thank the officers, the men and women of the Savannah Police Department, again, for their quick work, for clearing many of these cases. But I submit to you that people make people safe. Police don't make people safe. And so if we're going to be partners, we're going to need everybody again to continue to do their part, particularly during this time. So that ends my prepared remarks, and I'll entertain any questions you may have. I guess we'll let Emma be first, since Sean will be last.
Good morning, Mr. Mayor.
Good morning.
One of my questions for you is that Dr. Fauci has come out and said that he is more concerned about people getting together over Christmas and the New Year, just because it's a longer extended period of time. And after seeing the numbers from Thanksgiving, what are your concerns about Christmas now here in our community?
I'm extremely concerned. But I think that we have to be realistic as well. Thanksgiving was a much shorter window. It was really over the span of maybe 4 days, and people did what they were going to do. We hoped that it would be down, but it wasn't. And we knew there was going to be a spike. With Christmas, which is much longer, people are going to do what they're going to do. I'm just asking for people to have a plan to be able to address how they manage those holidays. And to be honest with you, I mean, people have cabin fever and they're stir crazy. The mental illness implications of this are enormous. People have families that they need to check on. I have my own family. You know, I'm a son as well. And so I can't take care of other folks' families and not look after my own. So I'm just asking that people recognize the time that they're in. There are recommendations out there about how to conduct yourself if you do travel. But I think we have to reasonably expect that in the middle of January, that we're going to have a significant bump. As we look at our schools, I can't see if we experience a bump that we did over the 4 days for Thanksgiving, you know, the 10 days or so for Christmas will probably be astronomical. And so, you know, I'm concerned about, you know, whether schools will be able to even maintain a hybrid experience. We had a high school that has closed down because of COVID concerns, and so this is a very critical time for us. As you know, we've already said we're not issuing permits for January and February of next year, again, because we expect this to occur.
My other question is, I know a few weeks ago you expressed your frustration about people not wearing masks, especially down there at Riverside, where the Christmas market is right now. Have you seen any progress or any, I guess, improvements since then?
I was down there this weekend, much better. But I think I've also saw a more pronounced city presence. We now have a member of the city manager's executive staff that's on duty, to include members of various departments. And so I saw more presence. I saw more masks. There are some places, there are still, you know, clubs and various establishments where people are just not doing it. So we're getting better, not where we need to be. And then I've understood there was some type of something that occurred over the weekend in Forsyth Park that I received pictures on that I've asked for them to check out. People they had a great time, no mask. There was a bunch of folks. And so we just have to be more aggressive when we see this type of behavior to break it up politely. But again, this is about our community. I don't want Savannah to be everybody's wonderland to come and get folks sick and then go back home and live their best lives, and Savannah's numbers are rising. I'm concerned about people who work in our tourism, our various industries, and I'm just very concerned about them, their families, and what they have to deal with.
My last question for you this morning, and I'm not sure my other media friends are wondering the same thing, maybe people at home. I noticed that you have decided to leave your mask on today, which is something that you haven't done in the past. Would you mind just explaining your decision today?
Sure. I did it last week.
Well, that's my fault for not being here.
Well, if you were here, then you'd have seen that I wore my mask. That's why you have to come every week, because you don't know what I might do. No, as you know, there were recommendations from the CDC as it relates to wearing masks indoors. And so I'm just modeling the behavior that we want to see. And so although you all are well past 6 feet away from me, although I know this area has been sanitized for my protection, again, we want to make sure we model it. So I have a larger mask because talking through those other masks, I mean, the masks look better, but they just give you lockjaw. So I'm putting on a larger one to kind of help me to be able to breathe. So, but if you come every week. All right, come every week.
I burned myself there.
That's right.
My question is actually for Chief Mentor or whatever.
Okay, we'll bring them up.
Good morning.
Good morning.
This may also be better for Chief Mentor, but maybe you can also touch on this. As you know, there were 2 homicide investigations over the weekend. Do you have anything to say about those investigations or just a message to people about the violence that happened recently?
Yeah, behavior unchallenged remains unchanged. And I think, again, the unfortunate part about it is that, you know, our police are doing the work. We cannot, I mean, it's the issue of behavior, and it's the introduction of guns. And so, you have folks that don't know how to model good behavior, or folks that are not able to peacefully resolve conflict, whatever that is, and then you introduce a gun into it. We have deadly circumstances. Chief might want, I don't want to get into the details of what has occurred, but as usual, I'm familiar with every incident when it occurs, and then some of the circumstances. But we have to change this behavior. And I'm tired of parents losing their children, children losing their parents, but on the other end of it, we have to find ways to intervene in the destructive behavior that leads to these incidences. Again, it's an unacceptable spike in violent crime. It is consistent around the country. And although many cities are worse than ours, some cities are better than ours. Once we get our criminal justice system up and running, we're able to get some of these folks off the street. I've asked Chief Mentor, we want to bring in our federal partners where we need to, and I would love to start charging some of these folks federally. Because I think we have to send a message clear that gun violence is not appropriate in our community. So, but I'm sure I'll make that his first question when it comes up.
Good morning, sir.
Good morning.
My question focuses on the vaccine rollout. I think you touched on that earlier.
Yes.
But can you again talk about the significance of that for our community? And then also, I believe Governor and Dr. Toomey will be in town today.
I'll be with him.
That as well. So what will the city's plan be whenever the organization gets a hold of some of those vaccines? Who will they go to first? And do you know how many there will be?
Marty will be first, the chief will be second. And then everybody else will just fall in. But no, well, we're excited because it does mark a significant turning point in our fight against COVID-19. We're happy to have received the shipment here. We know also that people from our community have already been vaccinated. The vaccine by itself does nothing. The vaccination is what provides that protection. 2 shots, one provides up to 50% within a week, and then you get to the 95 from the booster, the second shot. We are not healthcare providers, but we have committed to Dr. Davis and Dr. Toomey that we will do whatever we can do. I think we've proven ourselves to be good partners with our Coastal Health District and our local health department. They're using our Civic Center now for COVID testing. And whatever facilities we have, whatever we need to do to help, if they need my big mouth, I don't mind using it. But we need to make sure that people are able to get vaccinated. And part of that is for us to have a significant public education campaign that we're willing to help to do, to make sure that people understand very clearly that part of the way to get past this is the behavior and then the vaccine. So if we're modeling still the same behavior, watching your distance, wearing a mask, and washing your hands, and having a vaccine, soon, hopefully, in our community, we get to the 70% or so that is considered herd immunity, and then we're able to start really making a turn. So I'm willing to do whatever we can do to help.
Public safety, executive staff, those will be the priorities when the vaccines start rolling in first. Will those be required by the city?
It is not my position, and I'm not discussing with the city manager to require someone not to take it. But what I've heard is you'd rather have the vaccine than having the COVID. On the other end of it, the city, we don't want to be purveyors over someone's health, but we also recognize there's a responsibility for people who are coming to work to keep their coworkers safe. And so, we won't mandate it, but we might have some other ways to be able to deal with that. So I think that, many will. I don't think very few people can stand extended periods of time out of work because of COVID-19. I think we have to make the case for our employees about why this is important, why this is necessary personally for them, and then also for those they work with every day.
Thank you, sir.
Thank you. Chief? I have some here, Chief, as well, so I can get to them. And when Chief gets his, we're going to do that. We'll do that live here, and I'll minister it.
Thank you, Mayor. Good morning, folks.
Good morning.
Cody, I think you're first.
Yeah, man, I got a lot of them make you look good first. All right, Chief. So my first question, or my only real question, Mayor was touching on some new procedures with SPD, no chokehold, warning shots, things like that. And the way of things that have gone on this year, raining back to North Florida and all that going on, how do you think this stuff is going to help SPD, look good in you guys' part? Why do you think these things are important in the wake of all that stuff?
Well, first and foremost, it's not about looking good. It's about making sure we continue to maintain a professional law enforcement agency with professional standards and policies in place. The things that you're hearing about are things that either we had already been in the process of revising in our policy or had already been revised. As a nationally accredited agency, as an agency that's been nationally accredited and state accredited for quite some time, we're very confident in the fact that all of our policies and procedures meet national best practices. But there are a couple of things where we realized that we can make some minor revisions, and those are the things that we changed.
Yeah, thank you, Chief.
Sure.
There was a question about.
Good morning.
Can you go over what those minor revisions were versus what was already in place? If you just tell us what was new.
Well, there are a couple of things. We had a provision in our policy that still allowed for warning shots. I failed to see any particular situation where I felt that would have been necessary, so we went ahead and pulled that out of the policy. That was something that was left in the policy based on an incident that happened several years ago. The other thing is we wanted to provide a little bit more clarity on the lateral restraint hold that was in the policy to make sure it's a little more clear to members of the department.
Well, let me say, the other thing is that these are recommendations from the task force. The recommendations go to the city manager and chief, so they were not mandates. And so this is the reverse of that now. The chief and the city manager now returning back to the community those changes.
Good morning, Chief.
Good morning.
My question for you is some of the crisis intervention that the mayor had touched on. Why do you think that it's important for these officers who are responding to some of these crisis situations to have this type of training to be better protecting their community, but also be better servants of the community?
Well, that's a great question. I mean, we're very proud of the fact that about 70% of the members of the Savannah Police Department are trained in what we call CIT, Crisis Intervention Training. National average is about 40% of law enforcement agencies. We're proud that we not only meet that standard, we exceed that standard. That's very important because a lot of times, a lot of the vast majority of people that we meet on a daily basis, some of them are going through some type of crisis. And any training that we can provide to officers to enhance their skill level in assisting individuals who are going through that crisis or going through those difficult times, I think is a great benefit for us. So for us to continue to show a commitment to continue to enhance that level of training says a lot about our agency.
And my last question for you is some of these recommendations and revisions to policies for the department, what was kind of your overall thought about some of these recommendations? Do you think overall it would make the police department even better than it already is?
Well, you know, we're proud of the fact we feel we have one of the top law enforcement agencies in the country, being a nationally accredited agency, a state accredited agency, and an agency that's known throughout the nation as being a leader in the law enforcement profession. Anything that we can do to continue to enhance that level of professionalism and that standard and that reputation of our department is a great credit to the department and a great credit to our city.
Thank you, Chief.
Anything else? Well, thank you all so much. Have a great day. Be safe. May God bless you. And may God continue to bless the city of Savannah.